The link has been in existence for the last 4 years. We started off with a scoping visit to identify the various issues that we could work together on collaboratively, and from that a number of priorities were set. One of which was the therapeutic management of violence and aggression, because this was a very important issue for Mirembe. They were also very interested in developing their substance misuse services, and so we've been working on that, and also looking at the IT infrastructure within the hospital. And we've also been trying to develop the occupational therapy provision in the hospital. I suppose the main area where we've concentrated work has really been around the therapeutic management of violence and aggression, where we have had members of staff from Mirembe Hospital coming over here to undertake training, so that they can then become trainers of other staff within the hospital. And they have actually gone back and run training courses with staff at Mirembe Hospital, and they're also training staff in a couple of other regional hospitals in Tanzania.
Previously, we had no any structured way of managing these patients. Therefore, we have a structured one. How you can attack, you can defend yourself if the patient has attacked you. How you can contain a patient who is aggressive. Therefore, it has changed, yes. Yeah, it has changed, yes. We had no any other means, except we were using our own way of handling them. But now we have a certain way of managing them. That's good.
In my case, I would say previously, since I had no skills in dealing with psychiatric patients, I was a bit afraid. I would work consciously knowing that I'm surrounded by a psychiatric patient. Well, now I'm a bit comfortable. I'm more comfortable because I know what I'm going to do.
We work collaboratively with Mirembe Hospital on all the different things that we do. So we're not sort of going in there and parachuting ourselves in to do different things. We're actually trying to work with them in the areas that they feel are priority areas. And so we occasionally have staff from here going out to Tanzania. We've had their staff coming over here, and so we actually learn a lot from one another in terms of how to deal with very difficult issues, but with minimal resources.
It's terribly refreshing that we learn from each other, because at a time, the NHS is at a time when it's so strained with resources, and we're having to be very minimal about and effective about the way we deliver care. And I found that refreshing to talk to a nurse who's managing a 60-70 bed unit with 70 patients and 3 nurses, and drawing lessons from how you can deliver care, effective care, with minimalist resources.
During our last visit, there were 2 other colleagues who went to Tanzania, and they were looking at how they could. They were doing a sort of scoping visit, really, to look at how community services could be developed, and they came across another organisation in Tanzania called Basic Needs, who have actually set up it's a bit like a social firm where patients actually are able to run a business and derive an income from that, so they become a lot more self-sufficient. Mm-hmm. We're actually hoping to work with Basic Needs to see how we can develop that sort of service around Dodoma, because their project at the moment is actually based in Dar es Salaam. Yeah. So we're hoping to actually work with them in developing community services, but we've also put a proposal through to the Ministry of Health for them to incorporate within their sort of annual budget for a programme that would run over 3 years to develop the discharge process and support process for people out in the community. So that would involve engaging with local pharmacies, engaging with local community mental health support workers,
Yeah.
and also hopefully working with the patients themselves so that they could then set up their own supportive networks.
Peer support is whereby people suffering from the same thing support each other. In this case, mental illness. People who have suffered from mental illness or are still suffering support each other. They share coping strategies. For example, there is a lot of loneliness in mental illness. When you get a mental illness, in most cases, you lose your social circles. So having peers as your friends, as people you talk to, is something that brings back humanity into you and gives you recovery.
I think from a patient perspective, in terms of being a mental health patient in Tanzania, it's not a very enviable position because there's a lot of stigma around mental illness. People are not really accepted within their local communities when they become ill, and often because there hasn't been much in terms of early intervention in mental health, then things have actually got to such a state that they've actually created a lot of problems in their own communities, and that makes it very difficult for them to then go back again. And there's also a very large amount of misunderstanding about mental illness in the community.
Very excited that we've begun to develop a work stream for nurses to look at the nursing needs within nurses in Mirembe. There is a scoping visit which is planned for January, in which I will travel to Mirembe. The preparatory work for that involves looking at joint presentations that we as nurses from CNWL will deliver, and vice versa to us. Some of the preparatory work is also around developing the buddy-up system, the supervision system that we have, looking at learning needs for the nurses, specifically nurses within Mirembe, having an open discussion within the link about what is feasible, how we can prioritize those needs, how we can develop those needs. And I'm excited to be talking about nurses who are involved directly within patient care, because I think sometimes people who know best about what is effective is actually people who are actually involved in patient care. So excited to be developing a work stream for nurses and developing learning capacities at both ends within CNWL-Mirembe.